In this video, I will discuss a very life-threatening infection, rabies. Rabies is a fatal viral zoonotic disease. It means it is transmitted from the animals to the humans, and it is caused by a rabies virus that belongs to Rhabdoviridae family. It is transmitted either via bite or saliva, as most of you know. If the animal is infected, it can transmit this infection. For example, dogs, bats, raccoons, and foxes. These are can transmit if they are infected animals. Pathophysiology. First thing is virus enters through the bite wound. Second thing is it replicates in the muscle cells. Third thing is it attacks the peripheral nerves, and through these peripheral nerves it enters the central nervous system through retrograde movement. So it travels towards the central nervous system from the peripheral nervous system, and when it reaches the central nervous system it causes encephalitis. After causing encephalitis, it can travel back to the salivary glands, and from the salivary gland, it is again ready to be transmitted to the other humans. Incubation period. Mainly incubation period is 1 to 3 months, but this time varies depending on the site of the bite. If it is near head and neck, then this incubation period is very short. If there is high viral load, this incubation period is very short. And if the host immunity is suppressed, then this incubation period is also short. Clinical presentation. First one is prodromal stage. It lasts for 2 to 10 days. It mostly has fever, malaise, and headache, but the pathognomic features that are present in this prodromal stage are pain, itching, and numbness at the site of bite. Also, patient may have nausea, vomiting, and anxiety, but these are important: pain, itching, and paresthesias. These are pathognomic for this prodromal stage of rabies. Then neurological phase. Neurological phase exists in two forms. First one is furious, dramatic encephalitic rabies. It is mostly seen in 80% of the cases. It leads to hyperactivity, agitation, and patient may have visual and auditory hallucinations. The patient when sees the water, then he has pharyngeal muscle spasms leading to hydrophobia. Also patient has aerophobia, fear of air drafts. And there are spasms of the pharyngeal muscles of the patient, and there may be periods of lucidity that alternate with the periods of excitement. This condition ultimately progresses to paralysis, coma, and lead to death. Then we have paralytic or dumb rabies. As the name indicates that it is less dramatic as compared to the first type. So in this there is gradual flaccid paralysis, and it mimics the Guillain-Barré syndrome because it involves symmetrical limbs. Also, it is equally fatal, so it also kills. Coma and death. Death occurs due to cardiorespiratory failure within 7 to 10 days of symptom onset. So it is a very fatal illness. Diagnosis. Usually clinical diagnosis because of history of any bite. Negri bodies are present. Intracytoplasmic inclusions are known as Negri bodies. These are seen in the brain tissue post-mortem. So after death, when the brain is seen under the microscope, brain tissue, then it shows inclusions known as Negri bodies. PCR or fluorescent antibody test for viral RNA and antigen can be done, and serology also is helpful. Rabies antibodies in the serum or CSF may be present, but these antibodies are not of any use because these cannot kill the virus. Management. Once the symptoms appear, no proven effective treatment. Almost always fatal. There are 99% chances that the patient dies if the patient undergoes. So if the patient has infection, almost 99% of the cases patient die. Patient only requires supportive care like ventilation, sedation, pain relief. And if the patient comes to you with a bite and you suspect the patient can have rabies in future due to this bite, then you will go for post-exposure prophylaxis. Post-exposure prophylaxis is a life-saving measure if given before symptom onset. Immediate steps are: first one is wound care. You should clean the wound with soap and running water for almost 15 minutes. Then apply povidone iodine solution. Give rabies vaccine. If the patient has not taken the vaccine previously, Then on 0, 3, 7, 14 and 28 days you have to give vaccine. This vaccine is given intramuscularly at 0, 3, 7, 14 and 28 days, and it is given in your deltoid region in the shoulder muscle. WHO approved cell culture vaccine, for example, purified vero cell vaccine is preferable. Then you will give rabies immunoglobulin if the patient has no vaccination status. So, in case of rabies immunoglobulin, for category 3 exposure, transdermal bite or scratch, mucosal contact with saliva, you have to infiltrate half inside the wound. So half is given inside the wound and rest is given intramuscularly distant from the vaccine site. Mostly we give in the gluteus. So first half in the wound and the rest half IM into the gluteus. Dose is 20 international units per kilogram of this human RIG, or equine. If it is given as equine, then 40 international units per kg. So a 70 kilogram person requires 40 into 70. So patient requires 2800 international units of this equine. So of this 1400 is given into the wound and 1400 is given into the gluteus. So this is the method of giving this immunoglobulin. If the patient requires pre-exposure prophylaxis, before exposure the patient requires prophylaxis, especially for the doctors who deal with animals, then we give vaccine on 0, 7 and 21 and 28 days. So this is the method for pre-exposure prophylaxis. Key preventive measures: vaccinate domestic dogs and cats, control stray animal population. So this is all about rabies, a life-threatening infection.